And on the topic of resistance, a question: what is the best approach to support an individual who is resistant to care? So either one of you can handle this. Leah, if you want to start from a clinical perspective, if you're counseling a caregiver, someone who's dealing with someone who's resistant to a diagnosis or to getting help.
Yeah, that is very difficult, and it's very common. It's really being patient, and choosing words wisely, not trying to, choose words that don't say, I'm going, make them do this, or you have to do this type of thing, because that type of language can often make someone more resistant and heighten moods and things like that. So, making different suggestions passively. Have you tried this? Do you think you could try that? Um, maybe giving them a card that you got. Oh, I went to this conference or whatever. So doing things more passively, asking them, uh, what do they feel like they might need, or let's work on a goal. Like, what's one goal that you feel like you want to accomplish, and let's work on that. And maybe it's just getting a job. Okay, well then what are the steps to that? But I think the main thing is being patient and making sure that your mood and your language is calm, because otherwise they're going to just come back at you more irritable.
And I imagine with, as you both have talked about, the anxiety aspect of PTSD, that affects the way that, you're feeling when you're in a PTSD state, and the way that you would like to be considered and talked to and have your, you know, state of mind held. And I think as caregivers, we always want to fix, we want to swoop in and have the answers, we want to make everything better. And that's not our job. Our job is just to allow everyone in our lives to have the dignity of their own experience, and to, as you said, Leah, provide them with resources and to listen and to help. But it's very, very hard. This is something that I've been a resistant patient myself, and it's very, very challenging. Jennifer, do you have anything else you wanted to add about that aspect of resistance?
Sure. Yeah, I think Leah is much better suited to answer the question from a clinical standpoint. But just something that I've observed from my previous work with veterans is that there are many of them that remain undiagnosed and untreated. And it's because they are resistant to care. And that's for many reasons. But one that I see that's very consistent is that there's such a stigma around PTSD and getting the diagnosis. And so, to Leah's point, it's about patience, but I think destigmatizing, letting your loved one know that it's okay and this is a physical problem, it's not just in your head, I think could also help in some ways.